Most difficult months for people with winter blues are often January and February, but there's one day in particular that stands out. Researchers tell us that it's January 24th, which is this coming Tuesday, as the most depressing day of the year. Kathleen Hall of the Stress Institute is one of those researchers, and she's the author of this book as well, A Life in Balance, Nourishing the Four Roots of True Happiness. And she's with us right now here in Atlanta. Good to see you, Kathleen.
Hi, Fredricka.
All right. Well, a lot of folks, feel depressed or feel kind of blue, but when do you know it is a clinical depression versus something a little bit more benign, something like this, sad?
Absolutely. You'll find that seasonal affective disorder will emerge about November, December, and it'll usually subside. It's spring.
And how does
when it gets lighter?
How does it pop up? Is it as simple as I don't want to get out of bed?
There you go. I don't want to get out of bed. You can think about the things you love to do. Eat. Are you putting on weight? How about sleep? Are you sleeping too long, or is your sleep interrupted? Sex. How's your sexual behavior? Also, I say a good thing is ask your friends or listen to your coworkers. They are really good indicators because depression is insidious. Lots of times we don't know we're sinking into it, but our friends and our coworkers will help us out. I call it the buddy system.
Well, when it's as simple as not wanting to get out of bed, a lot of folks would associate that with, oh, it's snuggly warm underneath the sheets. I just don't want to get out, because I'm comfortable where I am. So how do you know it's not as simple as that, as opposed to people thinking, you know what, it's something much more serious?
Well, if you think it's serious, and if you start having self-deprecating feelings, suicide, and you really are not showing up for work, and it can have some serious consequences in your relationship, in your home in your family, I definitely suggest you go either to your physician or go to a psychologist for an evaluation.
And some of the treatments aren't necessarily as extreme as getting real medicinal, prescriptions, etc. It can be a little bit more, I guess, docile, right?
Absolutely.
What are some of the avenues besides the light treatment?
Exactly.
That we
The American Psychiatric Association recommends stress management practices, which is what I do. So I have a program that I call SELF Care. That's an acronym. SELF. S is for stress.
Nice to remember.
And serenity. So all you have to do is something as simple as listen to music for 2 minutes. It increases your serotonin. If you start singing, you get an immune boost of 240%.
E, exercise?
E is exercise. In your office, bring some weights. Just sit there, pick up your weight, and it increases your bone density. Something as simple as that.
L?
L is love. Make sure that you email a friend Monday, Wednesday, Friday, and have lunch with 2 friends a week.
Oh, that's nice. And F?
And F is food.
Everybody
make sure you
loves
meet
that.
omega-3 fatty acids, which is fish. If you don't like fish, make sure you take a gram of fish oil. Or you can eat B6s, which is anything from mangoes, bananas, tuna sandwich.
Now, there are other things that make, or I guess all these things that converge that makes January 24th, this upcoming Tuesday, stand out. It's not just, the weather outside or it's gloomy. There are other things that come into play as well, right? Bills from the holidays.
One is weather, because the weather, we do have less light. It changes our melatonin in our body. Second is debt. We got our Christmas bills. 80% of Americans overspend during Christmas. So between January the 10th and the 15th, we got our bills and a reality check. And New Year's resolutions, interesting enough. The first week of January, you're excited. The second week, you're bargaining like, gosh, I was going to quit, doing this.
but it's just so
and
hard.
then the third week, we really feel like a failure.
Oh.
Yeah, it's very interesting. So those things all converge. Plus, my theory is I've seen enough clients and patients for 2 decades. There's so much overstimulation of the senses during December. Food, family, friends, excitement, music. And then December turns kind of quiet. What am I doing? A disorientation.
Kathleen Hall, the book is A Life in Balance, Nourishing the Four Roots of True Happiness. Thanks so much.
Thank you, Fredricka.
And of course, we'll all be now looking toward Tuesday, kind of energized, knowing how to attack that day, which could potentially be a very sad day for a lot of us. All right, Kathleen, thanks so much.
Take care.
Well, is it safe to eat fish from Louisiana? Environmental quality officials say, yes, it is. Ahead, a check on the Gulf Coast fishing industry. And later, imagine being torn from your parents and held by Saddam Hussein's henchmen. That story of this young lady straight ahead. Also, why she and her family support the U.S. involvement in Iraq. CNN Live Saturday continues in a moment.